Hi, good afternoon. I think I'm on the air. Yes, I'm on the air. All right. Hello, and welcome to Staying Alive and Fit. I am your host, Liz Goodman. Call in and ask me any question you may have. I'll find the answers you seek to all your fitness and medical questions. I'm not a doctor or a nurse. The sight of blood makes me squeal. I'm just an ordinary gal trying to navigate through the maze of all the ways I can stay fit, focused, and feel fabulous at almost 50. I had a debate with my friends the other day as to whether or not I'm actually almost 50. So I'm turning 49 in September. To me, that's like really close to 50. To some, I'm not 49 yet, so I'm not allowed to say it. But either way, my goal with this show is to meet some really fabulous doctors from my friend David DePino, who work for Tenet Health and Tenet Florida Physician Services, and to learn as much as I can for myself and to help you about nutrition and health, Eastern and Western medicine, and all the things that I just can't have access to anymore now that Obamacare has sort of made it difficult for me to see any doctor I want without a referral. So whether you're 20 or 80, male or female, mixed messages about what's best for your health can make you feel like you're on a runaway train. So get on board and take a medical mystery ride with me, because each week we're going to talk about something different, something I choose or something you could choose if you email me at liz@stayaliveandfit.com. You could check out my brand new website that I just built. It's www.stayaliveandfit.com. And you can call in to talk to us at 888-565-1470 and participate. Watch us live on the internet right now at www.amp2.tv. That's A-M for Mary, P for Peter, the number 2.tv. www.amp2.tv, and the number again is 888-565-1470. I'm going to tap into what's hot and happening now in the medical industry, featuring experts, physicians from Tenet Florida Physician Services, and breaking news with PR specialist David DePino. So listen for 60 minutes or miss it in a minute. Today's show is all about getting heart healthy, and we'll be having a heart-to-heart with Dr. Juan Velasquez. I know I've destroyed his name. So the thing about Dr. Velasquez, I did it again, he's an interventional cardiologist. And let me tell you, girls, if you're tapping in right now and you want to check us out on AMP2 TV, he's pretty sexy, pretty hot. And what's even really hot, and which is making my heart pound a little bit, besides being like an awesome interventional cardiologist, he's a singer back in Colombia, and he has an album out, and I hear his voice rocks, and I'm going to try to entice him to sing a little bit for you girls and guys, because some guys like to hear heart-healthy doctors singing too. So before we get started, I wanted to tell you that one of the things I want to talk about with Dr. Velasquez is about not just what an interventional cardiologist is, but about what specifically Afib is, because that's close to my heart. My dad has Afib, and he ended up having a minor heart attack and a minor stroke because he didn't properly attend to it as quickly as perhaps he should have because of fear. And I think a lot of people, when dealing with their heart, are afraid. So one of the things I want to do tonight is try to lessen your fear, lessen my fear, by having a nice heart-to-heart with the doctor. So let me get back to some of the ways that I want to go with the show. For instance, tonight, I'm going to tell you some really cool, hot happening tips about the heart. Like, did you know, according to Science News, replacing butter with vegetable oils does not necessarily cut heart disease, that we were not always told to do the right thing? As a matter of fact, butter might not be a health food, but researchers unearthed more evidence that replacing it with vegetable oils just doesn't do any good. So you may as well enjoy the butter over the oil, as long as it's in moderation. And of course, we all know about fruit. Fruit consumption cuts cardiovascular disease risk, but did you know it's up to 40%? That's how much it cuts your risk. According to a study done in China recently, eating 5 daily portions of fruit and vegetables is associated with a lower risk of death from any cause, particularly from cardiovascular disease. And eating more than 5 isn't going to make your risk any less. It's just 5. I don't know why that number. I don't know what the reason is. Maybe the doc can tell us, but apparently the study says 5 is all you need, 5 servings a day. So what I did is I went online. I found this great heart-healthy grocery shopping list of foods to keep in your kitchen that will help lower cholesterol and keep your blood pressure in check. And this is what is great for you to have. in your refrigerator. And one of the things that I found out, which I'm really excited about, because I'm like big dairy girl, I like cheeses, I like cottage cheese, I like cream cheeses. You don't have to cut out the dairy to be heart healthy, because it's a great source of calcium, which is really important for your heart and it's really important for your body. You just have to keep it low fat or non-fat. So obvious foods like apples, berries, bell peppers, broccolis, all of these things are really great to eat as long as they're in moderation. So I think I have a call in. What I did tonight is I actually got a woman that works in Boca Raton. She's a fabulous nutritionist. She was recommended by a friend to me. And I asked her if she would do me a favor and call into the show tonight and discuss with us a favorite heart-healthy recipe of hers. She's Julianne Koritz. She's a licensed registered dietitian and nutritionist with a private practice in Delray Beach for the last 12 years. She can be seen or investigated or researched or contacted through her website, which is leapdiet.com. That's LEAP diet.com. And as a matter of fact, she was just recently featured on CBS News. So I think I've got her on the phone, right, Ken? Yeah? Are you there, caller?
Yes.
Hey, Julianne, how are you? Welcome to the show.
Fine. Thank you very much for having me, Liz.
You're welcome. You're actually in the room with the doctor and David DePino, so you could say a shout out to them, and then let's see if the doc can. I know he's coming on in the next half, but maybe he can take notes on what you're recommending and let us know how great it is, because I'm sure it's fabulous.
I hope so. We'll see what comes up here. It's always interesting for people's likes and dislikes. So
why don't you tell us a little bit about yourself quickly first, and then surprise me.
All right. Well, I'm not your traditional registered dietitian. I work with the immunological aspect of what's going on in the small intestines. So I tend to work with people that have elevated cholesterols, bad hearts, migraines, fibromyalgia, celiac, Crohn's, any autoimmune type of disease, skin diseases, and so what I do is I utilize a specific blood test that looks at 150 different foods and chemicals to see what the reaction level is, and I change the way they eat and help them repair their immune system so that their body can start functioning again.
Interesting. Well, I know you mentioned that you needed to have a certain, to be a dietitian or nutritionist in Florida, there was certain degrees or laws that you had to follow, and maybe you want to tell me a little bit about what those requirements are?
Well, in the state of Florida, to practice nutrition, you have to be a licensed registered dietitian. And, of course, you have to get a bachelor's with a master's and do an internship and then sit for the boards. So
you're well-studied, in other words.
Pardon?
You're well-versed. You're well-studied.
Yes. You have to keep up, every couple of years we have to have CEUs and keep up with the times of what's going on. And we work closely, usually with a lot of physicians and in the medical field.
So did you hear what I said about having the ability to eat some cottage cheese and cheeses as long as they're low fat? Do you agree with that?
And that is true sometimes, depending on the protein content and what you got to look at the whole diet, not just one aspect, but you got to look at always the big picture of everything, because calcium is really important in the diet and for the heart and for the contraction of the heart, not just the bones. So, but there's also a lot of different other minerals that you will get in a lot of different fruits and vegetables and your dairy products. So it just depends on what the person can tolerate and what they actually are reactive to or not reactive to.
So a person who would come to meet you or visit with you, they would get a very specialized program that you would put together for them based on their blood type?
No, it's not a blood type. It's a blood test, and it's an endpoint patented blood test that looks at the type 4 hypersensitivity, which is a white blood cell response to an inflammation. So how many inflammatory chemicals are being released? So we look at release of, like histamine is an inflammatory chemical. Everybody has heard that. But there's also things like cytokines and leukotrienes and prostaglandins that are also inflammatory chemicals that are released by the various white blood cells.
That's really interesting.
It is pretty interesting, and you can learn more about it on my website if you go to leapdiet.com, and I've got a little, you can sign up to receive a paper that I wrote that explains it much more in detail.
Would you mind giving us your telephone number quickly, and then I want to hear your great meal that you were going to tell me about.
Sure. 561-303-3690.
Why don't you say it again, just for anybody who's grabbing that pen?
Okay, again, it's 561-303-3690. That's the office phone, and Teresa will answer, so you can speak with her, and she'll let you know what we do and how we work.
Great. Okay, well, I'm so thrilled you joined me on the show today, and I'm looking forward to actually meeting you in person and bringing you on the show if I can entice you to do so in a later date. And in the meantime, I want to hear this fantastic food that I know you were going to tell me about.
Yes. Well, yeah. Hopefully, I got a couple little things I wanted to offer. So the first thing, of course, as you mentioned earlier, having 5 servings of fruits and vegetables is really important. And one food that everybody loves is lasagna. And we know that the cheese and the pasta and the tomato sauce is just so heavy.
Oh, my God, you're making me hungry right now.
Yeah, well, I have an alternative for that. So my suggestion is to make a vegetable lasagna. So you can use a mandolin, and you can make zucchini strips and noodles or sweet potatoes. So use one of the two, and you layer them. You can, now if you want to use the ricotta cheese or cottage cheese, or you can actually make a cheeseless, like a meat cheeseless, out of like cashews or out of like ground up different vegetables.
Very interesting. Cashews.
Or use a bean. Cashew cheese, or you could make like a hummus out of lentils or pintos. And those have been shown to be very effective at lowering triglycerides and cholesterol levels, eating more of the beans and the nuts in the diet. So, and then you make a tomato pepper, red pepper sauce with your luscious little spices, and then you make 2 layers of that, and you bake it for about 20, 30 minutes in the oven.
Sounds fab. Like, are you inviting me to dinner tonight or what?
Sure, come on over.
Based on this topic, it's funny that you mentioned the vegetable lasagna, because I'm Jewish and I have Passover coming up on Friday night, and my aunt, who's joining me for Passover, she's a vegetarian, and she's like, well, don't forget when you're like making the food, no matzo ball soup for me, none of the traditional things. I've got to make her something else. So maybe I'll make that lovely lasagna you just. So if I want to send my listeners to get the recipe, can you post it on my blog, on my website?
Sure, I can do that.
That'd be fabulous.
I can do that, yes. No problem. So I have one little tidbit I want to give out, if that's okay.
Absolutely.
Which I think is always interesting for people. So, usually with cardiologists, and I'm sure he's listening, the number one medication that they give for someone that's had a heart attack or whatever is take an aspirin a day. That's just kind of common knowledge to take that every single day. So there's a saying that's been around for years that says an apple a day keeps the doctor away. We've all heard of that, right? So what do you think it is in apples that keep the doctors away?
What is it that's in an apple to keep the doctors away?
Yeah.
I have no idea. The worms that get in and eat it?
Well, actually, what's interesting is that most fruits and vegetables have a natural anti-inflammatory, anticoagulant type of factor called salicylic acid. And salicylic acid was extracted from all these fruits and vegetables to create aspirin. And that's
interesting. Wow,
so
I had no idea.
Fruits and vegetables can actually be beneficial for any heart patient or anybody with any, diseases, or if they're getting sick or whatever. It can actually help you. And that's why, I try to have people to start juicing 2 or 3 vegetables, like taking an apple and celery and a little cucumber, and then juicing that and having it once every other day.
That's fabulous. And so, in a sense, that should help me with my migraines, too. I actually had a little migraine all day today, and I'm afraid to eat any kind of fruit on a day with migraines, because I feel like the sugar in fruit is just, I don't want sugar in my body. But maybe what you're saying is that kind of good sugar is still good because it has this natural healer in it.
Right.
Interesting.
Exactly. So now that you've just told me something that you have, I've got a question for you.
Okay.
With migraine patients, there's a common pressuramine that people are reactive to if they have a keen sense of smell.
Oh,
Do you
yes.
have a keen sense of smell?
Oh, forget it. I mean, anybody walk past.
I'm going to be your best friend.
I'm sorry, I didn't hear. I didn't mean to talk over you. I thought you had finished there. What you said something about a keen sense of smell, and then I cut you off. I apologize. What was that you said?
That's right. A keen sense of smell, and a person with migraines with those two factors, they tend to be reactive to a natural occurring chemical called tyramine.
What is that?
Tyramine. And tyramine is natural occurring in animal meat because it's an amino acid. It's a pressuramine. It causes migraines. So any leftover meats, prepackaged meats, deli meats naturally have tyramine because as meat is cooked and it's set, the tyramine level increases the older it gets.
Interesting. I really can't wait to meet you because that, like, ironically, I never eat lunch meat, and I ate some lunch meat today, and I've had a headache all day.
All day long. Well, there's that why.
Very, very fascinating. I've got to move along now because I do have the doctor here waiting, but I cannot wait to meet you and find out ways to avoid these migraines because I am that girl that somebody walks like a mile away from me with a weird cologne or a smell, and I've got a headache for the rest of the day. I am so smell sensitive that, believe me, I'm right there with you, girlfriend. I understand. So, thank you so much for calling in. I'm going to just one last time let you give out your phone number and your website, and then we'll talk about having you on again.
All right. Well, thank you very much. My office phone number is 561-303-3690, and my website is leapdiet.com. That's LEAP as in Paul, diet.com.
Wonderful. Thank you so much, Joanne Koritz. It was wonderful having you on our show. Julianne Koritz. I apologize. It was wonderful having you on our show, and we will catch up with you real soon. Don't forget to put that food on our blog. I apologize for destroying your name there, and we'll speak to you soon. We're going to kick it to a commercial right now and come back with breaking news from Tenet from David DePino, and then right thereafter, our sexy hot heart specialist.
Stay Alive and Fit is your weekly dose of information about health, wealth, fitness, or food, so you can live longer, age gracefully, and stay alive and fit. Stay tuned. Liz will be right back. Don't turn that dial, or you just might miss this week's Healthy Hot Tip. With Obamacare, it's almost impossible to get comprehensive medical care and information. What if you want to see an acupuncturist or chiropractor? No way. They won't pay. Need a specialist without waiting 3 weeks for a referral? Ask Liz. She provides VIP medical information for the masses. No referral, no marketplace, no hassle. Get on board and stay alive and fit with Liz Goodman. Mondays, 7 p.m. or watch live on amp2.tv and like us on Facebook.
Hey, we're back on the air, and I was about to put on some lipstick. You caught me. All right, here we go. That's why this show's about being a gal and talking about all sorts of fun things with doctors and medical people and trying to look pretty while we do it because there's a sexy hot doctor in the room. I can't keep saying that enough, ladies. You got to tune in for this one. And what I'm going to give you a little bit of a heads up is that he can sing, girls. I think I mentioned that before, and he's going to give us a little toodles from his sexy voice, so I can't wait for it. So, okay, as promised, we have David DePino. He gives us some breaking news from Tenet, Florida Physician Services. Here we go, Dave. What do you got for us tonight?
Thanks for having me, Liz. Hey, everyone. I'd love to remind you that it is April, is National Autism Awareness Month, and we have a pediatrician at Tenet Florida Physician Services right here in Boca Raton and on staff at West Boca Medical Center. She recently wrote a blog on the autism spectrum disorder, and you can find the blog at www.drnorinoocampo.com. That's DRNORINAOCAMPO.com, just like it sounds. Just a reminder also, we have the Advanced Neuroscience Network Symposium 2016 coming up. This is for all nurses and doctors in the area. So if you have a friend or family member that is a nurse or doctor, this is something that you have to let them know about. We have hosted the annual Neuroscience Symposium through St. Mary's Medical Center for the last 5 years, and it's never been held in Boca Raton. We've actually had it up at PGA National in Palm Beach Gardens. So due to the success and growth of our neuroscience programs, this year we are expanding our efforts to include many components of not just neuroscience, but also cardiology, and we're inviting some internal medicine physicians. Now, the name of the title of the program, it's a 2-day program. It's Interdisciplinary Care in Neuroscience, Breaking the Silos, and it will take place on Friday, May 13th, which is for the nurses, and Saturday, May 14th. Both are at the Boca Resort and Club in Boca Raton, right here in Boca Raton. Some of the topics are cryptogenic stroke. We also have a little bit about hyperacute stroke treatment. And then also we are going to have some...
there's a pediatrician you had mentioned earlier, and I wanted you to just talk about the fact that she had said, I guess she's a pediatrician and she specializes with autism?
Yes, correct.
Right. So maybe you can just give out her information for us.
Oh, yeah, definitely. The best way to contact her is drnorinoocampo.com. So that's drnorinaocampo.com. And yeah, like you said, she's right here in Boca Raton. She's actually on staff at West Boca Medical Center, which is just west on Palmetto Park Road. And as you know, pediatricians help in the diagnosis process of autism. Mm-hmm. So her blog kind of touches on every angle of the autism spectrum disorder.
And there's so much autism these days, and we don't know where it's coming from. And it's something that when I was a kid, we didn't hear a lot about, and now we're hearing about it all the time. And there's questions about whether or not it's from too many shots, not enough shots, this or that, or the food, or this, or it's, now I was reading on her blog, it might have to do with preeclampsia or something that happens during the pregnancy. So I'd love to have her on the show, Dave, and see what's really going on with that, because I know I have a lot of friends that have children with autism. I remember back when I lived in LA 20 years ago and I first learned about autism. One of my dearest friends in the film industry, his name is David Jones, and fabulous man, and his child was diagnosed with autism, and it was it was very hard, very, very tough, because they were a very wonderful family, and they were dealing with this difficulty, trying to get their child to do things that you feel like your child should be doing at 1 and 2 and 3 years old. And I know they became very, very knowledgeable and did a lot for charities. And but unfortunately, sometimes situations like that, marriages break up as a result of having to deal with children that are, a learning experience, especially 20 or 30 years ago. And it saddened me to see this happen with people, but I know it happens often when parents get together and they have a child that unfortunately is beautiful and wonderful and amazing, but has something like autism. It can be a struggle. And I would love for the doctor to come on and maybe give tips to parents as to what they can do to sort of, get through those tough moments and work through it and be there for that child and make it better and easier for the other siblings who may feel like they're getting slighted sometimes because so much attention has to go to that child.
Definitely. And I grew up, my next door neighbor had autism, so I learned about it at a very young age. And Dr. Ocampo, I'd love to have her on your show. She very interesting, been in this area since 1995, and she speaks not only English but Italian.
Oh, wow, interesting.
So you can go on that.
Okay, and I know there's a lot of very functioning autistic kids, so it's not always the worst thing. Most of the autistic kids I know are brilliant. It's just a matter of figuring out what it is they especially are brilliant with. So I'm going to just kick it to the guy that we've all been waiting to hear, and we're going to take a very, very short commercial break just so we can have Dave switch seats with our doc. And is it okay, Dave? Is there anything else? That's great.
Yeah, I'm really looking forward to hearing what he has to say.
And did you know, right before we go to break, did you know that here's a hot heart fact that I found out that I want to talk to the doctor about, that the fluctuations of your heartbeat may actually affect your wisdom? According to a study at University of Waterloo, wisdom is a matter of both heart and mind. When a person is sitting and not active, their heart rate varies. I think we all know that. Well, apparently, people who have greater variation apparently have a better capacity to work together and help reason wisely about complex social issues. And though the study also says they don't necessarily mean these people are wiser, in fact, it actually says some of these people may use their cognitive skills to make very unwise decisions, especially because many of them are egocentric. So I think that's an interesting thing. Like, I had no idea that somebody who's got like really fluctuating heart rate might actually be like more cognitive but still stupid, basically. So it's kind of, I mean, can you be cognitive and wise and not wise all at the same time? I don't know, but let's find out soon right after the break.
Live local? Have a fitness or health question? Ask Liz, and you just might be called to guest star on her next show. Experience what it's like to get VIP medical treatment live, in person, on the air. Email your health or fitness questions or suggestions to Liz at stayaliveandfit.com. Ask Liz on Facebook, follow her on Twitter, or post a photo to Instagram. And watch Stay Alive and Fit Mondays at 7 on amp2.tv or listen right here on WNN 1470. Times are tough, and right now those in the commercial world know that being heard via advertisements is the name of the game. AmpSquare.tv understands how important advertisement is and is proud to express that it's truly the only plugged-in internet television production company on the market. Amp2.tv live streams all their shows across all the major selling markets in the U.S. and abroad. Call them at 866-224-5422. The AmpSquare.tv library allows productions to be seen over and over again, making commercial platforms more usable. Call 866-224-5422. Toll free 866-224-5422. Amp2.tv, the first and only internet television network that's truly plugged in. 866-224-5422. That's AMP2.TV. In today's world, only the elite receive the very best care or advice. Stay Alive and Fit with Liz Goodman is like VIP MD for the masses. Ask Liz medical and fitness questions live on the air. Call us at 888-565-1470 and tell us what you want to learn more about. Tune in for a sneak peek each week from David DePino, PR specialist for Tenet Florida Physician Services, a division of Tenet Health. Dave will tell you breaking medical news prior to its release. Hear it first on Stay Alive and Fit before it hits the presses. So listen for 60 minutes or miss it in a minute. Mondays on Talk Radio WNN 1470 or watch us on amp2.tv.
Hey, and we're back.
Quiero vivir una aventura entre tu abrigo. Invéntala conmigo antes que salgan el sol y los testigos que jamás entenderán lo que has vivido. Las batallas del ayer y las que hayas de perder.
Wow. Oh, my heart's pounding right now. He got me going, girls. It's a heart happening. Wow. The doctor with the voice, oh my goodness. And he's our heart specialist, Dr. Juan Velasquez, interventional cardiologist. Welcome to the show.
Thank you so much. It's a great honor to be here. Thanks for having me.
Absolutely. Thank you for joining us. You really do have a fabulous voice.
Thank you so much.
Before I get into this whole topic of the heart, you want to tell me briefly a little bit about your singing career? Because I think that's your passion too. You seem like you have a couple passions in you.
It is my passion. You know, I've always been extremely musical. And I was privileged enough to have parents that always stimulated me to have a very balanced life in general. So as a kid, I was expected to have a good academic performance at school, but I was also expected to have a good athletic and artistic performance. And so, you know, at a very early age, I grabbed a guitar and I just started, you know, playing with it. And at some point during my teenage years, I decided to start writing songs, and it got to a point where I had a pretty good, sizable pool of songs. And it all happened in a very organic way. You know, I was never really trained in songwriting. I just needed to express myself, and it got to a point where I felt like I needed to do something with those songs. And so I started looking for a producer, and I found a producer to work with back in Colombia, and I recorded half of an album. That was probably like 5-6 years ago. And then I guess at that point I stopped because I had.
I'm sorry. Let me interrupt you. So you've only been in this country for 5 or 6 years?
No. I was actually. I've been here for actually 12, almost 13 years.
Okay.
But the producer that I was working with was back in Colombia.
Okay.
So what we did is we did all the pre-production remotely through the internet, and then I would go to Colombia for 2 weeks and get in the studio and just work with him and record.
Wow.
Yeah.
So did you release any albums?
Yeah, so I actually released my album, which is composed of 10 songs, all written by me, and I actually had a single on the radio in Colombia back in 2013, and it was quite successful. Actually, for 6 months of my life, I was doing 3 weeks cardiology and 1 week music.
Wow.
Which was very exciting, but a lot of traveling.
And
so
exhausting.
Exhausting. After 6 months, my body started to feel it, and I took it easy. But it was really good.
Well, that kind of leads me to like the whole idea of stress on the heart. Like how much is too stressful? Because, type A personalities, which I can clearly see you are, I think, right? I mean, you want to do everything and...
She's diagnosed me already. Yeah. I've been diagnosed with type A personality.
Am I wrong?
I guess I do have a type A personality, yeah. That would be fair.
I think many of us that are high achievers, right, are type A because we don't let anything stop us. We kind of barrel over whatever we have to barrel over just to get it done, and therefore a lot of people with our personalities can end up with heart problems, right, because of the stress we put on ourselves and the lack of sleep and the high energy. I mean, it's also good because we're usually thin or, full of exercise and full of beans, as my mom would say. But at the same time, it's a lot of stress and pressure to be the best, right?
No question about it. I think in today's society, we're all expected to work and produce, compete. And, that's good because, that's what, keeps us kind of going and, that's what helps us make achievements. But at the same time, that if you don't moderate that could be something that could be bad for your health. And so it's good to be high-strung to a certain degree, but not to overdo it.
Well, I guess there's a fine line between multitasking and overtasking, right? Maybe?
I would agree with that. I think life is about balance, and so it's good to mix it up and keep it diverse and do a little bit of everything. But you're right. I think overdoing it and having that overachiever kind of personality ends up causing issues with your health.
So that brings me to your passion is for music, but then your passion is for medicine. And what when you went into medical school, what made you think to yourself, I just love the heart, and besides wanting to be a heartthrob, and I'm sorry to keep playing the puns, but they're just so easy. So besides being a heartthrob and, singing and swooning the girls, what made you want to massage hearts and work with the hearts? And actually, what is the difference between a cardiologist and an interventional cardiologist?
Yeah, well, first of all, first of all, I was never one of those kids that always wanted to be a doctor. There's a lot of things that I really enjoyed, and when I was 15, 16 years old, I wasn't really sure what I wanted to do. The one thing I have to say, though, is when I was thinking about what to become, is I was really amazed with how the human body works, and that's really what got me interested in medicine. A lot of people that go into medicine say that they did it because they wanted to help people, which is good, but I think that should be a feature not only of doctors, but people in general. The main thing that kept me interested in doing medicine was I was just amazed with how the human body works. And
but what's the difference between, let's say, interventional cardiology? I'm just moving you along because of our time. I'd love to sit and listen to you all day long. Trust me, I would love to have you come back. But I just want to really get to my listeners so they understand what an interventional cardiologist is.
I'll try to make it simple and practical for everybody. When you think about a heart doctor, you have to think that there's essentially three types of heart doctors. There's the general heart doctor that will see you in the office and that will see you in the hospital if you need to go into the hospital. And then in addition to those, there's plumbers and there's electricians. So there's the plumbers are the people that will open up your arteries if they're blocked, and that's what I do. And then the electricians are those are the types of cardiologists that will deal with the electrical aspect of the heart, and those are the ones that do pacemakers, and those are the ones that if you have an abnormal heart rhythm, they will put a catheter in your heart and burn the area that's causing the abnormal heart rhythm.
But that's not you.
That's not me.
So what exactly do you do? What does that mean? So like one of the things that I was mentioning is that, this is close to my heart because my dad had something. I mentioned this to you and I mentioned earlier in the show. My father has atrial, I don't even know how to say it right, Afib, I know it as.
Atrial fibrillation.
Right. And, even before I get into that topic, well, actually, let's get into it because I hear the phone ringing and I know he was going to call in about it. Why don't you tell me, are you the kind of doctor that would deal or help with a patient with AFib and what exactly AFib is?
Well, AFib is such a common problem that because I do a lot of general cardiology in addition to my interventional cardiology work, I see a lot of patients with atrial fibrillation. Now, when it comes to the advanced treatment of AFib, like atrial fibrillation ablation, where they put in a catheter in the heart and burn the areas that are causing the AFib, I don't do that. But I do see a lot of patients with AFib on my day-to-day practice because I do, general cardiology in addition to my interventional cardiology work, and a lot of the patients that I see in my interventional cardiology practice have AFib, and it just turns out that a lot of the risk factors for plaque buildup in the arteries, which is what I deal with as an interventional cardiologist, a lot of those risk factors are the same risk factors for atrial fibrillation.
And so that's really the point, is the interventional. The point is if they see you, your point is to hopefully intervene before they have to take that next step and help them to reduce those risks before they need those stents and things like that, correct?
Well, actually what I do, or interventional cardiology, is the term that's being used for many years to refer to that specialty which deals with all the catheter-based procedures that we use to diagnose and treat heart disorders. So what I do is I put catheters in the heart, I inject dye in the coronary arteries or in the heart itself, and I make an assessment of what the coronary arteries and the heart itself look like. Not only the coronary arteries, but also the peripheral arteries, the arteries of the lower extremity, sometimes the renal arteries. So that's essentially what I do. So we diagnose blockages by injecting contrast dye in the heart and in the arteries, and then if we see something that needs to be addressed,
you then refer to another doctor who then steps in?
I then go ahead and perform what we call angioplasty, which involves putting a wire in the artery, delivering a balloon to the side of the blockage, and then inflating the balloon to relieve the blockage and restore blood flow to an area that's lacking it.
Is the caller on the line, Ken? Okay, so I'm going to have Michael Goodman. He's my dad, and he's stubborn old geezer dad, because he was dealing with AFib for quite some time before he actually got the treatment we were all pushing him to do. Dad, are you there?
It was only 7 years.
Can you speak up a little bit?
Yeah, I can't speak too loud. My voice is hoarse.
Oh, sorry. Okay, so...
Doctor, how you doing? Doctor, I've basically... had almost everything that you do. I mean, in 2004, I had 4 stents in the same artery. In 2006, I had another one in the same artery. Somewhere in the area of about 2010, I had a real minor stroke and a mild heart attack. If it wasn't for the sophisticated equipment, you wouldn't have known anything that I had them, except one of my left pinky was numb. And I had AFib since 2006, and finally, as my daughter said, I didn't see any reason for it. I was stoic. I would get severe pain in the shoulder and in the clavicle area in the chest. It was like a pounding, and at some point, I started taking medication because they didn't want me to take medication right on at the beginning, afraid I'd be a cowboy and overdo it. But at some point, I was allowed to do it, and I sat with the condition until 2013, October 23rd, when I had the ablation up at Cornell, Wild, in Manhattan. But in any event, I have a couple of questions. My blood work is excellent. I take medication. Everything is fine. My weight is fine. I'm anywhere between 5'9.5" and 5'10", depending what year I take my height measurement.
Yeah, you are shrinking, Dad. No
yeah,
offense.
I weigh somewhere between,
Very thin, just like you.
which scale, between 160 and 164, I guess, been constant for many years.
Mm-hmm.
But my question is this: I'm a lousy sleeper. I was an A personality as an attorney for years. I mean, I had to do 12 things at once, and stress is something that always bothered me as far as inability to sleep. So I take 2 Tylenol PM every night for the last 10 years at least.
Another battle of ours.
Well, but every once in a while, I'll like once a month maybe I'll take some pills from Israel, Bundamin, or I don't take the other stuff, the American pills, because I was told there's a little memory loss in that. Maybe you can confirm that. And my only question is, since with me I'll take 2 Tylenol PM, it'll let me fall asleep generally within 15 to 20 minutes. And then maybe 3 or 4 or 5 hours later, I'm up, and it's difficult to go back to sleep. So I just lie in bed for another hour or two, figuring my body will be at rest, not permanently at rest, just at rest. And that's about it. So my question is, if I get 3 or 4 or 5 hours sleep at one time, continuously, consecutive, if I get another hour, if I take a nap during the afternoon, is that the same thing as getting 5 hours or 6 hours continuous? If I break it up to 3 hours and 4 hours or 2 hours, something like that, would that help my overall wellness and not affect my heart?
Thanks, Michael Goodman and Dad.
Michael, pleasure talking to you, first of all. And, well, let me start by saying that sleep medicine is something that nobody really talked about until about 25 years ago, when awareness was raised about the importance of diagnosing sleep disorders, to the point that it's become a specialty. There's doctors that do purely sleep medicine. Usually pulmonologists or neurologists that are interested in sleep are the ones that go into the whole sleep medicine field. I think the quality and the quantity of your sleep are key things that have to be kept in mind. There's been an association between sleep disorders and specifically sleep apnea and many cardiac-related conditions, such as hypertension, such as atrial fibrillation, such as heart failure, pulmonary hypertension, and even sudden death. And that's not to mention a lot of non-cardiac or not directly cardiac situations that could potentially affect the heart, such as obesity, depression, and even things such as colon cancer. So I think you really need to focus on optimizing the quality and the quantity of your sleep. And I do not think that sleeping 3 to 4 hours and then compensating for that by sleeping 1 to 2 hours the next day during the afternoon is going to be enough. I think you should try to get at least solid 6 hours of sleep during the night.
And get off the sleeping pills, because it's like I think it's a secular thing. The more he takes them, the more he needs them. And if he just would go a week without the sleep, he'll break the habit of the sleeping pills. But this isn't a sleeping pill doctor. I mean, it's a whole other show. I think the important part is how is it affecting his Afib and his heart, because he's sleeping in this pattern. That's my concern.
Yeah, there's definitely a high likelihood that the poor quality of your sleep is affecting your Afib, is affecting your blood pressure, and of course, as you might know, high blood pressure leads to exacerbation of your cardiac condition. And if you already have stents in your heart, having an uncontrolled blood pressure and having Afib, that's not going to help the overall situation. So I would definitely encourage you to see a sleep specialist about it. And let me ask you a question. Have you had a sleep study?
To have a what?
Have you had a sleep study where you have to spend the night?
I have a twin brother who has sleep apnea, and he has that mask or whatever they put over his face. I don't have that. He had that because he was snoring, and that was lack of oxygen. So he has that. My blood work is excellent. I mean, I do take Crestor and Zetia. I'm taking Coumadin because I had the ablation, and so they always say since ablations, as you know, are probably not more than 75 to 85% guaranteed to prevent another attack by having the Coumadin, or it used to be the Plavix or Xarelto. If you have something, you won't drop dead or have a stroke. But my blood work is excellent. I mean, my cholesterol is down probably 100, 125. My HDL is probably in the high 60s, low
Dad?
70s.
I'm going to have you call the doctor and have a consultation. I got to get back to my show, but I appreciate you calling. I think the bottom line is, you need to get some sleep, and the doctor's telling you what we're all telling you is that if you to have a heart that's healthy, you need to, I guess, sleep is a very important part of it.
Michael, come see me anytime, and you're free to decide if you want to come with your baby girl or by yourself.
I'd be happy to. Thanks for listening. I didn't give you a chance to talk too much. That's my problem.
All right, thanks, Dad.
Bye, Michael.
Okay, so based on what he was saying, obviously, I mean, he's got the gift of gab too, but he means well. I mean, he's nervous, like a lot of people are, especially when they have AFib and they have this kind of a situation, and then they can't sleep and they're personalities and they're running and they're doing and they're stressed. What's the next step? Like, what do you do? What's the best steps that he can take, to stay healthy once you've been diagnosed and you've had the stents and you've had all these things? How do you live a normal life, I guess?
Yeah, that's one of the things that's really important to touch upon, which is the fact that a lot of people think that they need to go see a cardiologist when they have a problem. And the whole idea is to go see a cardiologist for preventive purposes before you are actually diagnosed with heart disease. So, preventive cardiology has become actually like a subspecialty of cardiology, and there's a lot of doctors that specialize in preventive cardiology. Of course, in our practice, Dr. Joe Friedman and I have the ability to provide preventive cardiology services. And, we welcome anybody that wants to come to our office for preventive reasons. Even if they haven't been diagnosed with heart disease, we'll be more than happy to help them out, prevent issues from developing. And that applies specifically to males after the age of 45, and then females after the age of 55, okay? Because that's the time when heart disease starts becoming a really big issue.
And do I have to be very concerned because my father has this, that therefore it's in my genetics, or is it just, is it something that's not necessarily a genetic, thing, and it's just the way you lived your life and the food you ate along the way?
There's definitely a genetic component to heart disease, just like, to every condition, every disease, there's a genetic component and acquired component. So the genetics definitely play a role. For heart disease specifically, family history counts as a risk factor. If you have a first-degree relative that's been diagnosed with heart disease at an age earlier than 45, if it's a male, or 55 if it's a female. So
if it's before the age of 45, that's the key factor when it comes to genetics. So if it's 70 or 60 or it's not as much a concern. That's more about lifestyle?
Yeah, it has to be a first-degree relative.
Okay. First-degree meaning a parent?
First-degree parent or sibling.
Okay.
And it has to be premature. And premature is defined as an age less than 45 in males and an age less than 55 in females.
So, Doc, can you give out to our listeners your address and phone number so they know how to get in touch with you?
For sure. So we are very conveniently located at Florida Medical Center, and the address is 3001 Northwest 49th Avenue, Suite 104, Lauderdale Lakes, Florida 33313. And our phone number is 954-714-0686. Phone number, again, 954-714-0686. Again, we welcome anybody to come see Dr. Friedman and me, Juan Velasquez, even if you haven't been diagnosed with heart disease, we'll be more than happy to provide all the counseling that's necessary to prevent any issues from developing in the future.
So I know there had been a question that somebody emailed into us, and I'm trying to see it because it was on my screen, but while I'm waiting for it to come back up, I had read that, Frank Sinatra's son, there's the question. And before I get to it, Frank Sinatra's son died of a heart attack recently. Did you read about that?
I wasn't aware of that. No.
Well, apparently, it was a sudden, it was a sudden death. He died of a heart attack. So obviously, it's in the news. People are talking about, this often. And now we have a question from Twitter, which is, can bacteria in the mouth hurt the heart? And I know this is a huge concern of a lot of people, with dental insurance is so hard to find these days. A lot of people just ignore their teeth. And I know that can be very dangerous for your heart. I know for me, I need a lot of dental work, and with a family history, it's a very nerve-wracking thing. So what's your opinion on that, and how can you help yourself not end up with heart disease if you have gingivitis or some dental issues?
Yeah. So the first thing that I'm going to mention regarding that is that atherosclerosis, which is this issue of plaque buildup in the arteries, is actually an inflammatory disease. Mm-hmm. So any state that leads to chronic inflammation will favor the formation of plaque in the arteries. And in that regard, if you have a chronic inflammation in your mouth, like in the gingival tissues, that it's definitely been associated with an increased risk of atherosclerosis. So yes, gingivitis and oral issues have been associated with chronic inflammation and atherosclerosis.
Very frightening news for me, so you better run and see your doctors. But what I do like about having you here, Doc, is that, especially living in South Florida, it's interesting that we shouldn't wait till we're 60 or 70 or we have a heart problem to come and see a heart doctor. And I think the best information that you've given me tonight is feeling a little less afraid about if we have family members who had heart problems after 55. And knowing that that every person should go and see sort of a doctor to have their heart evaluated at a younger age will help prevent whatever might be coming their way at an older age. And I thank you so much for coming on the show. There's so many questions I want to ask you. I don't even know where. I need to have you back again.
Have me back.
That's all I can say. First, I just want you to swoon to my listeners. And I think that if I have you back again, I don't know if I can entice you to actually bring your guitar. And we can spend the whole hour, and the first half an hour, we could just talk about the music industry and some of the fun things you did when you were on tour, and listen to you jam a little. And the second half an hour, maybe I can have, a couple of call-ins and people that ask some really pertinent questions and
Sure.
really get more into your background and how you became a doctor and some of the cool procedures that are upcoming in technology.
Most definitely.
Do you do robotic procedures when it comes to the heart as well?
I don't do robotic procedures. Everything that I do is catheter-based.
What does that mean exactly? I mean, I understand it's going through the groin.
Catheters are spaghetti-sized tubes that we put in the arteries or in the veins to gain access to the heart and perform diagnostic and sometimes therapeutic procedures. So what I do is everything's catheter-based.
So I have a question here for you, which is, what's a typical day at your doctor's office like? I mean, is it only in the hospital that people have your procedures done? Is it in your office? If somebody comes to see you, do they expect to be there for 5 hours? Is it a whole day event, or can they be in and out? Give me a little bit about what a patient would expect if they come to see you.
Well, if a patient comes to see me, they're going to be taken care of right away. We have a very effective and knowledgeable team of people that will immediately get them checked in. And I have clinic, I have the ability to do clinic every day. I have the ability to accommodate my schedule to the patient's needs. So if anybody needs to be seen Monday, Tuesday, Friday, whenever they need to be seen, I will make some time to see them. I keep it diverse, and that's actually one of the things I like about cardiology is that I get to do a little bit of everything. So I'm in the hospital a lot, doing procedures in the cath lab. I'm rounding in the hospital. I'm reading echocardiograms. I'm doing stress tests, and of course I'm in the office as well. So usually what I do is the first thing that I do in the mornings, I go see my patients that are hospitalized, and I usually do that from 7 to 9, and then I go to the office and see patients in the morning, and then in the afternoon is when I do my procedures in the
So
cath
how
lab.
long would a patient be in your office for? And then I've got to kick it back to David to find out about next week's show. But, if I come to visit you, is it expect 2 hours in there between getting tested, an hour? What would I expect?
Yeah, so, getting checked in, it's, 5 to 10 minute process, then having your vitals checked and having an EKG done by the medical assistant, another 5 to 10 minutes, and then usually 30 to 45 minutes is the actual visit, and then checking out is another 5 to 10 minutes. So it's about an hour process.
Okay, well, I want to thank you so much for joining us today. If you want to get in touch with the Dr. Juan Velasquez, the interventional cardiologist, his number is 954-714-0686. I'm not going to go to a commercial break, so you're going to just see us switch chairs quickly because I want to have David come in. First of all, I want to say thank you. Is there anything else that you'd like to tell us before you go?
Oh, well, thanks a lot for having me. I really appreciate the invitation. And
you're going to come back with your guitar.
I will come back for all those people that have been listening to the whole show. As much as we appreciate the input from the dietitian, just make sure you don't replace your aspirin for an apple. Keep on taking your asprin, okay?
I appreciate that, Doc. But she was a great dietitian, right? Great nutritionist.
Oh, definitely, for sure.
She gave some great information, but yes, an apple a day keeps the doctor away, but aspirin a day also helps. So back with David DePino for next week. We have 10, 9, 8, 2 seconds left. Who's our doctor for next week, David?
Vivian Carter-Sanchez. She specializes in holistic well-being.
Ooh, holistic well-being. I can't wait for that. So thank you, everybody, for listening. Check us out on www.stayaliveandfit.com. Please like our Facebook page and the Twitter page. We just broke triple digits. Bye.
You've been listening to Stay Alive and Fit with Liz Goodman, a new innovative radio show that taps into what's happening now in the medical industry, featuring fitness experts, foodies, and medical professionals from Tenet Health, with breaking medical news from David DePino. Get it right here and be an active participant in your health. Mixed messages about what is best for your health can make you feel like you're on a runaway train. Get ready to hop aboard again next time for Stay Alive and Fit with Liz Goodman.